Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Avazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone. I hope everyone's having a great week. Welcome to another episode of the Egg Whisperer Show. Our show tonight, the title is The Best Fertility Treatment Options. I want to make this show fun and interactive. Paula, what's the phone number for people to call if they want to call and talk to us tonight?
You can join us at 866-298-9499, and we would love to talk to you.
That would be super fun. We're not going to call out your name. Paula will just make up a name for you. Curly and Fly or something. I don't know. Paula's much funnier than I am.
We'll get you good.
We'll get you good, yeah. So I just wanted to say hi. My name's Dr. Amy, also known as you can tell, I'm wearing a shirt just in case anyone's curious, the Egg Whisperer. And this is the Egg Whisperer Show. I have a last name, and just in case people want to know what it is, I just show a nice picture of a vase of flowers. My last name is Avazadeh, also known as a vase of flowers a day. And peonies are my favorite flower, in case anyone out there was wondering. So lots of fun fertility stuff in the news this week. We're still hearing a lot about sperm and the importance of sperm age when it comes to pregnancy rate and success. So one of the things I always tell people is make sure you know everything about your fertility story before you start treatment, and that includes sperm. And so it's nice to see something that I've been educating my patients about to finally be in the news, in the headlines, in the mainstream media that everyone can learn about. The other cool thing in the news this week, and this is a story or a company that I've been following for years, and this is called InvoCell. And so InvoCell is where you basically do IVF with less stimulation, but rather than incubating an embryo, wait for it, in an IVF lab, just wait, you actually place the embryo inside a tiny chamber inside the vagina. And then you go back to the clinic later after a few days, and every clinic's protocol is just going to be a little bit different. You remove the embryos from the chamber, and usually there's one or two, and those embryos get placed in the uterus. So this is pretty exciting that this is now FDA approved, and it's something that clinics and patients have been doing, and patients have been benefiting from for a while now. I would probably say, probably the last year that we've been seeing the headlines about InvoCell. And this is a great article in The Atlantic, and we'll post the article for you to read so that you can learn more about this. UCSF is actually doing a trial right now. I do think they're still recruiting for the trial. So if that's something that you're interested in, is being part of a clinical trial looking at InvoCell, you can certainly reach out to them. Okay, so now let's talk about treatment. So what's the one thing that everyone wants to give you advice on? And that's fertility stuff. And when you talk to your neighbor, they give you great advice, right? Advice that you certainly are not going to roll your eyes at. Number one, relax. That's a great bit of advice. Go ahead and relax. No, that's like the worst thing that you can tell someone who is all tensed up, is to just relax, to go on vacation, and to get drunk, right? You've all heard those things. But no, that is not the best fertility treatment. Certainly, I want people to do whatever they can to reduce stress. And I don't like to use the word stress. There's just something about that word that seems stressful. So I like to talk about what people can do to promote rest and relaxation. And there's a lot of things that you can do. Just look at the nature around you, get a pair of sneakers on, go for a walk. The other things that you can do is take good care of yourself. Maybe get a spa treatment here and there, get a massage. Other things that you can do is salt float. I talk about that a lot on my show, but I think that patients who want a little bit more rest and relaxation can certainly get that. And just look it up. There's a salt float probably basically in every major city now. It's quite popular. So when it comes to treatment, I know this sounds kind of strange that I'm a fertility doctor. I went to school for a really, really long time to figure out that an egg and sperm equal a baby, and yet I actually really want people to get pregnant at home. It's way more romantic. I promise you my office is not sexy or romantic. But if I can teach people what it would take for them to give themselves the highest chance for pregnancy at home, then whatever treatment we do together, they're hopefully going to have a higher rate of success. So that's why I showed that bed. That's the only reason why. Maybe I'm tired. No, I'm not. So let's talk about natural or nature and natural treatments. So living in California, I have a lot of extremely health conscious patients. They're really focused on what they're putting in their body, what the side effects are, and how it might affect them. So I do like patients to try and be as natural as possible if that's what they want. So the key to treatment, first of all, is figuring out what's your diagnosis and then addressing that. And the other thing I tell people is if you spend 10% of what you would spend on treatment on figuring out what your fertility diagnosis is, then hopefully you'll have to do less treatment because you'll be more successful later. So some of the natural things that I talk to patients about would be lifestyle changes like decreasing alcohol and coffee intake, addressing BMI issues if your weight is high, maybe working with someone like Dr. Bond that we work with remotely. His website is beweightless.com, and he works with my patients to help them reduce their BMI and he focuses a lot on nutrition. I mentioned acupuncture, seeing a nutritionist, and even seeing a hypnotherapist. There's actually a hypnotherapist in my building here, and I refer a lot of my patients to her, and she really helps them think, kind of retrain their brains, because I think when you are when it's ingrained in you that you are an infertility patient, I try with my patients to flip it around and say, no, you are a fertility patient and I'm doing fertility treatment. But we can't help as human beings to be more negative. So working with a hypnotherapist, believe it or not, I mean, she can help you stop smoking if you're smoking. She can help you with other things like if you have an eating problem. But I think the most important thing would be to help in retraining your brain into thinking and being more positive when it comes to yourself and how you're feeling about things. And then also seeing a therapist. So those are all pretty natural things that you can do. And I'll talk about how you can be more natural in whatever treatment you choose, whether it's IUI or IVF. So the treatment options that I want to go through today are fertility pills, fertility shots, IUI, and IVF. So basically those are the types of treatments that we have to offer patients as fertility doctors. So let's talk first about Clomid. I have a picture of a fire on the screen because basically Clomid can make you feel that way. It can make you feel like you're just walking right into an oven. You're going to have hot flashes, possibly mood changes, and changes in your cervical mucus, where before it might be egg white, and then once you take the Clomid, it's a little bit more like the Sahara Desert. I bring that up because before you take Clomid, it's really important to know what the side effects are. So if you're someone who is really headachy, has a lot of headaches, Clomid may not be for you because Clomid can cause headaches. If you're someone who runs more on the depressed side and maybe you're taking an antidepressant, Clomid should, in my humble opinion, should not be for you because of the side effect of depression that it might cause. The good news though about these medications is for the most part, they're completely out of your system within about 7 to 10 days. So after your last pill, you should feel like you're out of the oven and hopefully on your way to a really healthy pregnancy. So the way we prescribe Clomid is there are several different doses. There's a pill form, and that's the only way it comes. And when you swallow it, typically your doctor will give you a schedule. I tell my patients to start on cycle day 3. So cycle day 3 is 2 days after your period start. I call cycle day 1 the day where you see red flow, whereas 11 p.m. marks the I would say the starting point of where cycle day 1 could be. So sometimes people are confused about what's cycle day 1. So cycle day 1 is typically 11 p.m. or later or 11 p.m. or earlier. So let's say it's 10 p.m. tonight and your period starts. Well, today is day 1. That just makes it really easy. And then in 2 days, you'll start your Clomid and you'll take it for about 5 days. And when it comes to Clomid, I want to make sure that patients are being monitored and you know how you've responded. Get it? Clomid, responded. And how do we know that? Well, a simple ultrasound. So you can do an ultrasound and look over at an ovary, over here, at the follicle, and you can actually measure it. And the measurement of the follicle is an indication of, number 1, the size or maturity of the egg, number 2, your most fertile window, and number 3, how many eggs you're actually going to ovulate. And the other thing that we also look at is the lining of the uterus. So there's a certain texture and lining thickness that we look for to make sure that you're going to have the highest chance for pregnancy when you're doing your fertility treatment cycle. The other thing when you're doing fertility treatment is to ask your doctor if there's any reason to check the fallopian tubes. So the fallopian tubes are the embryo transport system. That's where the egg and sperm actually meet. So this here, over to my left, It's so silly, Paula, to be different. I feel like a weather girl. So over on the HSG screen, that's actually a picture of a hysterosalpingogram. Hystero is uterus, salping's tube, gram is picture. So on the picture here, what you'll see is open fallopian tubes. So do you have to do a hysterosalpingogram? No. But before you do treatment, if you want to make sure that you're doing the right treatment for you, because if your tubes are blocked, doing fertility pills doesn't make sense. But if your tubes are open, it certainly makes sense because the embryo transport system is wide open. So when you're taking fertility pills like Clomid, you can also do timed intercourse. Timed intercourse simply means having sex around ovulation. And if you're being monitored during your Clomid or ovulation induction cycle, then you'll know exactly when to have sex. The other option is artificial insemination, and that always just sounded like the silliest name to me. And I looked it up, and Paul's going to tell me what the definition is according to the Webster Dictionary.
You ready for this?
I'm ready.
It's a medical definition is a medical process in which semen is used to make a woman or female animal pregnant without sexual intercourse.
That sounds hot. That's really hot.
Yeah,
hot. So the thing with artificial insemination, I just think of an alien. I don't know why, I just think of space aliens. But basically, it's an intrauterine insemination. So if you look at the screen, you can see the catheter goes up to the very top of the uterus, and there's a little syringe at the bottom. And I always ask anyone who comes to the office with a partner, a friend, a sister, you name it, anyone who wants to help their friend get pregnant, they are more than welcome to push the end of the catheter. And it's always a good time for all. So do you have to do insemination? No. But the reason to do insemination is if potentially the sperm quality is lower, if timing of intercourse is a little bit off. Let's say you guys are both tired, you're working swing shifts, and it's just harder to have sex exactly when you need to make a baby, then sometimes insemination is the way to go. So the other option, aside from Clomid, is Femera. And Femera is also a fertility pill. I actually prefer Femera because of the lower risk of hot flashes, mood changes, the dryness that I talked about. It's an FDA-approved drug for breast cancer prevention, but I use it just like Clomid for my patients. So next is the fertility shots. Not these kinds of shots, although these shots sound really, really fun. Paul and I are going to go do these after this show tonight. Right, Paula?
That's right. We are. Rainbow shots.
Rainbow shots. So when it comes to fertility pills, the goal is to help a patient ovulate an egg, but depending on your situation, it may make sense to help you ovulate more than one egg. So when you do fertility pills, I tell my patients you will ovulate 1.6 eggs. Sometimes it's going to be 1, most of the time it's going to be 2. So that when you show up and it's just 1, I don't want you to feel disappointed because that's what happens when you take fertility pills. But when a doctor prescribes fertility shots, it's also to help a patient ovulate an egg, but sometimes the goal would be to ovulate more than 2 eggs and sometimes even 3. Because depending on your age or situation, ovulating more eggs will give the sperm a higher chance of penetrating and fertilizing an egg and creating a healthy embryo. So we continue to look at the ovaries and we monitor fertility shot cycles. And you start the shots in the same way as you would the Clomid at the beginning of your cycle. But you may have 2, 3, 4, maybe even 5 ultrasounds during a fertility shot cycle. And then just like I talked about IUI, or artificial insemination, also known as the turkey baster approach, no turkey basters in my office, you will be able to time your intercourse, do insemination, and sometimes with my patients I recommend a double IUI. And that doesn't mean 2 collections in one day, although I have done that before. But that typically means, let's say today is Wednesday, and I think your most fertile your peak window is going to be between Thursday and Friday. Well, I might do 2 inseminations, one Thursday and one Friday. And the way I can determine the most fertile window can also be with a trigger shot. I like to think of it as the love shot. That sounds a lot better than a trigger shot. But what the trigger shot refers to is an injection to induce ovulation. Because the sperm, it can wait in the tube for about 3, maybe even 6 days. But the eggs, they're quite picky. They're going to sit in the fallopian tube for, 6 hours, 18 hours, 24 hours tops. So you may want to have sperm waiting for the eggs before you do the insemination. So talk to your doctor about the absolute best window for you. Next time I'm going to wear a shirt that says if your ovaries are working, so am I. because it doesn't matter if it's a Friday, a Saturday, or a Sunday. If the time is right for your egg and sperm to meet, well, I'll see you in my office. So I want to talk now about IVF. And IVF stands for Is Very Fun. No, it doesn't. It stands for in vitro fertilization. So it's probably the most efficient way that we can help patients using fertility treatment. And what I mean by efficient is the one thing we didn't talk about when talking about fertility pills or fertility shots is the pregnancy rate. So typically for all comers with fertility pills, you're looking at about an 8 to 10% chance of pregnancy. When you add insemination, maybe close to a 15% chance. When we look at fertility shots, you're looking at potentially a 15 to 20% chance for pregnancy. And then the cost goes up because of the medication costs involved. But when you do IVF, you're actually putting patients on the shots, and there are natural cycle, there are more natural ways of doing it, where you don't necessarily have to take the shots. But when you meet with your doctor, you have to talk to them about what's important to you, the side effects that you're worried about, your previous treatment. So you can talk about exactly what the best treatment would be, and then that's what I do. It's not one size fits all for everybody. So this is a great blog, a great website written by someone who did IVF with me, and indeed she called it Is Very Fun. So we'll have the link up as well so that you can follow along in her journey as she actually not just had one baby but did a transfer for a second as well. So I hope you like the blog and think it's super fun. So I want this show to be super informative. I know that there are millions and millions of people out there who don't have access to a fertility doctor, who don't have access to even treatment. So if I can help one person just get information that's going to be helpful to them, well, I would say that mission accomplished for me, Paula, and Director John over there. So I came up with a series of things that I want every patient to know. It doesn't have to be after an IVF cycle doesn't work. It can be even before. It's a list of about 10 things. So let's just go through the scenario. You're watching this show and you want to know the best fertility treatment for you, and it might be IVF. So this list is something that you can go through before you've gone through the cycle. So I think the first most important thing is this. Why are you doing IVF? I see patients from all over the world and they've done IVF, and I ask them that question and they look at me like, well, I don't know. And I say, well, if you knew the answer to that question, the why, well, maybe you can do things to make things even better. I'll give you an example. So let's say the sperm quality is low and that's why you're doing IVF. Well, maybe if you improved the testosterone, took supplements, made sure there wasn't a varicocele, potentially the next cycle would be more successful. Well, I want to do those things before you even do that first cycle. So knowing your diagnosis is key. Doing a fertility gene test is available for both men and women now, so that you can learn about the right protocol for you. And we're learning so much about the DNA, or our DNA, and how it affects our fertility every single day. There are patients that I can help today that I couldn't have helped in the same way maybe even 6 months ago. And it's pretty incredible. So if you're a patient out there that maybe did treatment 2 or 3 years ago, and you're thinking, you know, I thought I did everything, it may not be a bad idea to re-explore seeing a doctor, telling your story, running some new tests to see if there's something that we can do to help you. So a few of the other questions are asking your doctor, why is it that they think that the cycle didn't work or you didn't get pregnant? And then really look at the protocol. Look at the medications used. And if you haven't done IVF before, be sure to ask, why is your doctor choosing those medications? Is there anything that they would add or take away? So, for example, HGH, human-derived growth hormone, a drug of abuse of bodybuilders, Lance Armstrong, famous for taking it. So it can potentially improve the quality of a woman's eggs in IVF. If, let's say, you have a high FSH, a low egg count, age over 40, maybe it's for you. So I would want you to know about that medication before you even did a cycle, so that you knew that you could add it up front and you can ask for it if your doctor already didn't bring it up. So the other question is asking the doctor, how many eggs are they expecting? And if you already did IVF, how many eggs did you get? How many were mature? Was that a surprise to them? Is there anything that they would do differently knowing this number? So this is the thing. You want to go into your IVF cycle with the right expectations. So I'll just give you another example. Let's say you're starting your IVF cycle and you're told that you have 3 follicles. Well, you should be sure to know before you continue your treatment that 3 doesn't turn into 6, doesn't turn into 12. Fertility doctors can only rescue eggs that exist. Well, for now, maybe one day I can help a patient grow more eggs than she already has. But right now, all I can do is help the 3 eggs that a patient has and help those 3 grow. So if you show up on the egg retrieval day and the doctor says, I got 1 or 2 eggs and you were expecting 6, well, that's going to be extremely disappointing. And what I tell patients who have less than 5 follicles is that there's a chance that we may not get a viable egg. And those are the kinds of things that you really want to know before you even start treatment. So a few other things to know is how many eggs were fertilized? Is that what you expected? Did you do ICSI? Should you maybe even consider PICSI? And you should know the quality of the embryos that you were transferred and what it means. And maybe you should consider genetic testing. Is that for you? Or maybe you should consider switching the day of transfer. If you transfer day 3, consider day 5. Maybe a frozen embryo transfer is for you. So again, writing things down, having a log, I tell my patients, keep everything in a binder, keep all your labs there, everything that we talk about, so that you always are on top of everything that's going on. So a few other questions to bring up, and these are things that I do for my patients, is if a cycle doesn't work, I always want my patients to know everything possible, including everything about the embryology part. So if you have questions about what went on in the lab, ask to speak to the embryologist. Embryologists, at least the ones that I work with, they love talking to patients about their case and telling them, what they saw, so that you can learn as much as possible about your DNA, your eggs, and the sperm, and how things looked when the embryos came together. So a few other tips, checking out the fallopian tubes, looking at the uterine cavity, consider doing some sort of, not just a cavity evaluation like a saline sonogram or a hysterosalpingogram, but maybe also a genetic test on the lining of the uterus called the endometrial receptivity assay, or looking to see if there's a marker for endometriosis in the lining of the uterus. And then the last thing to talk about are there any other things that you can do? Acupuncture, working with a nutritionist, changing your diet. So these are the things that I talk to my patients about before their cycle. I want them to know why they're doing it, what their fertility diagnosis is. Is there anything else that they can be doing on their own to give themselves the highest chance for pregnancy? I even help patients with, perhaps during the cycle they're very stressed. Maybe reconsider shifting your vacation time so that your vacation time is actually during your cycle, so that you can be as rested during your cycle as possible. So if you're watching this show and you have some questions for me, but I don't live in your area, that's okay. I can help you by checking your levels, talking to you about what they mean through my website, eggwhisperer.com. Obviously, it's on my shirt, it's on the logo. I'm super easy to find. So what I want to do is open this up for questions. And I know we got some questions emailed to us before the show, so Paul's going to read some off to me so that I can answer them.
Sure thing. So someone writes in, can an implantation pinch/cramp be a strong stabbing? Like, can it make you grab your side, take a deep breath of pain, or is that just gas?
Got it. Yeah, so we have a lot going on in our tummy. But after ovulation, what happens is you have something called follicle rupture. It sounds very dramatic. It's not that dramatic. But when an egg that's microscopic leaves the follicle, and I showed a picture of the follicle earlier in the show, the fluid can leak out of the ovary, and it can coat the peritoneal surfaces, which is basically the surfaces of your tummy, and it can make you feel cramping. But at the same time, a woman can actually, I've had many patients say, I actually felt exactly when implantation occurred. And you can actually get a sort of pinch or feel a cramp in the middle of your uterus. So it's hard to say, is that kind of symptom gas pain, is it ovulation pain, or is it implantation pain? So I hope for this person who's emailing us, I hope that it is pregnancy related and implantation pain. Any other questions, Paula?
Yes, we have another one. 1 second, sorry. And people, you guys can write it in the Facebook group too. It's just a second. Where did this go? I'm so sorry.
I think I remember the question.
Do you?
Yeah.
Start it.
So the question was about endometriosis. And if you have a cyst of endometriosis, what should you do before the IVF cycle? Did you find the question?
I'm looking for it. Yes,
No?
here it is.
Okay,
Sorry.
great. Go ahead and read it.
Yeah. Do you want the whole background on this?
Go for it.
My 2 IVF were canceled due to large endometriosis. I can't say this.
That's
I'm a layperson.
Endometriosis, endometriomas.
Thank you.
Yes.
A persistent cyst, and I have endometriosis. I was recommended to do laparoscopy in order to start the process. My question, will an ablation surgery solve the problem,
Right.
removing all of that without any complications, and will I be able to get pregnant in the next IVF cycle?
Right.
Or do I need robotic surgery?
Right. So obviously, without seeing someone, I can't tell you exactly what to do because this isn't cookbook medicine. It isn't one size fits all. There isn't an answer where if you have a cyst of endometriosis, it must be operated on, or it shouldn't be. But typically, when a woman has stage 3 or stage 4 endometriosis, studies show that doing surgery to remove the endometriosis may actually improve the outcomes. But it's really hard to do surgical outcome studies. You can't take 2 groups of people and say, I'm going to put group A through surgery and group B not through surgery, and then put them through IVF and then compare outcomes. Those kinds of studies are hard to do because they're just because of the nature of that kind of study. But in general, that's what the studies show. So if you have a large endometrioma, and you're my patient, if it's really big, let's say over 3 centimeters, especially if you've gone through IVF and we were not successful, I certainly would be talking to you about doing surgery like a laparoscopy and also with a robotic surgeon as well. Are there any Facebook questions, Paula, tonight?
No, they are so quiet.
No?
There's lots of hearts. There's
Lots
a lot
of
of love.
hearts. That's
Yes,
very cute.
thanks,
I
send
love
your
it.
way.
I love it. Okay, well, thank you guys for tuning in tonight. We'll be live again next Wednesday, 5 p.m., Egg Whisperer Wednesday. So join us. Feel free to send in your questions. You can email your questions ahead of time so we can read them live. You can also call in with your questions, and we'll be sure to make sure that we don't mention your name at all as you call in. So thanks again, and have a great night.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Avazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.